Hey there, everybody, and welcome to this presentation on polycystic ovarian syndrome and mental health. I'm your host, Dr. Dawn-Elise Snipes. Today, we're going to talk about what PCOS is, generally what causes it, what the symptoms are, and how it impacts thyroid, gonadal, and stress hormones, which then impact neurotransmitters and mood, and interventions that we can consider using or teaching to clients to help them manage PCOS and mental health. Polycystic ovarian syndrome, or PCOS, is a hormone and metabolism-related condition that affects the ovaries and multiple other body systems. So obviously, you're only going to see PCOS in people who were assigned female at birth. However, it is a lot more prevalent than you would think. Between 6 and 13% of females, and some stats say as high as 1 in 5 females of reproductive age meet diagnostic criteria for PCOS, although up to 70% remain undiagnosed or misdiagnosed. They are told that their symptoms are all in their head. They're told that they're lazy. They're told that they have hypothyroid or depression. But the underlying cause, which is too much testosterone and cysts that form on the ovaries, is not addressed. So all we're doing is putting Band-Aids on it. We're not addressing the underlying issue that's causing the hormonal and neurotransmitter imbalance. PCOS develops when the body makes too much testosterone and it's unable to coordinate normal ovulation, which causes irregular or absent menstrual periods. We know when people are stressed, when women are stressed, it can throw their estrous cycle out of balance. And that's part of those circadian rhythms that I preach about so much. When ovulation is not happening, when those regular cycles get disrupted, it causes a backup in the system. Risk factors for PCOS, and these are common risk factors for depression and anxiety and a whole bunch of other things. So we do want to recognize that there is overlap. The person could have had depression or anxiety and then developed PCOS, or the person could have had PCOS and developed as a result depression and anxiety. Either way, we do want to be cognizant of PCOS because there's no amount of talk therapy that's going to fix the ovaries. So chronic stress in any piece of life can cause hormones, gonadal hormones, to get out of balance. Remember, we've talked in other videos about how chronic stress disrupts the autonomic nervous system. And you've got within your nervous system, you've got your HPA axis, your hypothalamic pituitary adrenal axis, your HPT axis, hypothalamic pituitary thyroid, and your HPG axis, hypothalamic pituitary gonadal. When your stress response is kicked off, all three of them are called into action. And so they're secreting their hormones, which means that if those hormones, just like anything else, if those hormones are secreted too much, too frequently, too consistently, the receptors may start becoming tolerant to them and non-responsive, if you will. So then we start seeing disruptions in those hormonal fluctuations, in those hormonal cycles. So as I said, any kind of chronic stress, if the person's in chronic pain, if the person has sleep apnea, if the person has chronic interpersonal stress or low self-esteem, emotional stress, cognitive stress, whether that is negativity and pessimism and unhelpful thoughts, or whether we're talking about brain fog and cognitive overload because they just, oh my gosh, just thinking it makes their head hurt. And then environmental stressors. That includes too much noise, too much light, or too little. Smells that are overpowering. Anything in the environment that causes stress on the body. Exposure to toxins. Chronic inflammation. Well, chronic inflammation results due to chronic stress. And chronic inflammation can be caused by a variety of things, including environmental stressors, bacteria in the system, disruption or imbalance in neurotransmitters or hormones. Ultimately, all of those, anything that causes chronic stress is eventually going to cause chronic inflammation if it's not addressed. Ultra-processed foods tend to increase dopamine and serotonin really quickly to help people feel better. They're those comfort foods, but they also tend to spike blood sugar and cause insulin spikes and potentially insulin resistance. When our body develops insulin resistance, it has difficulty controlling blood sugar levels, and stress, every time we get stressed, it dumps a bunch of blood sugar. So if our body can't handle those blood sugar dumps effectively, then our A1C is going to go up, and that's a stressor. Endocrine disrupting plastics, that's an environmental problem, but if it is something that we know is going to greatly increase or greatly decrease estrogen or testosterone, it's disrupting the normal homeostasis, the normal balance of hormones, which can alter the hormone cycle that promotes ovulation. And when the ovaries are trying to ovulate, but they're not getting the signals, it gets backed up, to be oversimplify it. And that's when you can start getting the cysts on the ovaries. And alterations in the microbiome. Oh my gosh, I didn't see that one coming when I was doing my research. But alterations in the microbiome do contribute to systemic stress and can contribute to the development of some of these symptoms. Remember, a lot of our hormones are made or contributed to by the foods that we eat. And if our microbiome is not able to break down that food effectively to provide the body the building blocks it needs to make progesterone and estrogen and DHEA and testosterone, then we're not going to be able to function like we're supposed to. Consequences of PCOS. Physical consequences is the longest list, trust me, but these are the things that we need to be aware of when we are doing assessments with clients, when we're talking with clients, because a lot of times these things get blamed on other issues instead of doing a simple evaluation for PCOS. Obviously, we can't do that, but we can refer to their OBGYN or even their GP to do a screening, to do an assessment for polycystic ovarian syndrome. Physical. A person with PCOS typically starts having a lot of weight gain. And part of this down here is hypothyroid. Because the stress response is going constantly or semi-constantly, and the body starts becoming resistant, the thyroid receptors start becoming resistant to being stimulated by thyroid hormones, just like the cortisol receptors start becoming resistant to being activated by cortisol if they're bombarded for too long. So we start seeing hypothyroid. We start seeing weight gain. Because one of the things that is paramount, or not paramount, but a defining feature of PCOS is extra high testosterone compared to what it should be for that person, you'll see a lot of facial hair growth. And this can be hugely embarrassing for people. And PCOS often starts in adolescence, but sometimes later in life. But when you start having a whole bunch of facial hair growth, it can be very embarrassing for the person. And they may feel like it's their fault. They may feel, well, you can imagine. Extreme fatigue. Well, when you've got hypothyroid and when your estrogen levels are kind of in the toilet, you're probably going to have extreme fatigue. Irregular periods, because, and I'll explain this in a little bit more detail later, but the body is not signaling for ova to be released from the ovaries. Infertility. Well, if you're not releasing the ova and you have an imbalance of estrogen, progesterone, and testosterone, you're probably not going to be able to conceive, or at the very least, you may not be able to carry. You may have a lot of miscarriages. A lot of people who have frequent miscarriages have PCOS, and that is something that could be diagnosed and can be treated. It can be treated with hormone replacement therapy. There are a lot of things that can be done to address some of the symptoms. Can it be cured? No, but we can treat it. We see a lot more acne in people with PCOS due to those hormone differences. Hair thinning. So you have a lot of facial hair growth, but then you have your hair thinning on top. And the person typically has very greasy skin. And that's one of the most obvious signs of PCOS. If you're working with a patient who has hair that's significantly thinning, there's probably a hormonal component to it, and it may be PCOS. If they've got thinning hair, facial hair, weight gain, and fatigue, 80% of the time, you can probably bet that they have PCOS. Now, obviously, we can't diagnose, but when I see that in people, I am adamant that it's important that they go get some blood work done and get screened by their GP for PCOS, because it could make such a huge difference if they can get their hormones balanced out. Insulin resistance, we already talked about. We also see high cholesterol and hypertension in people with PCOS as a result of those imbalanced hormones. And sleep apnea. Sleep apnea is not necessarily the result of being overweight, but people who are overweight do tend to have more sleep apnea. Excuse me. People who have a history of trauma or chronic stress are also known to have a much higher rate of sleep apnea regardless of their weight. We need to ask all patients, even if they don't have any signs of PCOS, we need to ask about sleep apnea. Do they snore a lot? Do they wake themselves up and kind of, snorting periodically throughout the night? If so, they need to go see a sleep specialist. Eating disorders are very common in people with PCOS because they're trying to self-manage that weight gain, and they have so many other body image issues that they may try to address on their own, and they can very easily develop eating disorders. Now, eating disorders, it's almost always reciprocal. Eating disorders can cause imbalances in hormones and can cause chronic stress on the body and on the mind, which can also lead to the development of PCOS. We see chronic inflammation, already talked about that. Dysbiosis, imbalance of the microbiome in both the gut and the vagina. And that's really actually very important when we're talking about hormone balance. And as a result of the chronic stress and the dysbiosis in the gut, we also start seeing inflammation in the intestinal tract and leaky gut. The toxins leak out of the gut, go through the system, get up to the body, permeate the blood-brain barrier, and cause neuroinflammation, which is associated with, drumroll please, anxiety and depression. The point being, again, if your patient has several of these symptoms, it's important to treat the whole person. Interpersonal consequences of PCOS, reduced self-esteem and body image issues. You can understand why. If the person has fought with their weight all their life, or they suddenly start gaining weight, they have always or suddenly start fighting with excess facial hair. That can cause a lot of problems. A lot of these symptoms are blamed on, for example, premenstrual dysphoric disorder or anxiety or depression, and the person tries to fix it. They try to feel better, and it doesn't work. And then they start feeling like other people are blaming them for their condition. Additionally, in relationships, unpredictable bleeding can lead to dating or marital tension. If the person doesn't want to have intercourse when they are bleeding, and if they're bleeding regularly, sporadically, whatever, number one, it's harder to manage birth control if there's irregular bleeding because you don't know exactly when the ovulation's occurring. And some people just don't want to have sex when they're bleeding, which can, if you're bleeding 14 out of every 28 days, that can put a real damper on things. There also are fertility concerns, as I mentioned, that may strain partner relationships. If you really want to get pregnant, you really want to have a baby. There are a lot of self-esteem issues that go into being able to procreate for a lot of people. When I had my son, he was a micropreemie, and yes, I was able to birth him, but I wasn't able to take him home for 2 months, and my self-esteem took a hit. I really had to grieve the fact that I wasn't able to do something that I thought every woman from the beginning of time had been able to do, and I couldn't do it right. And it was really powerful for me. And people who miscarry, people who can't get pregnant, when women go through menopause, those same issues in different shades tend to come up when you start losing the ability to do one thing that you have been theoretically built to do and people have been doing since Adam and Eve. It can be very hard to cope with and very hard to grieve and accept the limitations that your own body has. Emotionally, people with PCOS have 2 to 4-fold higher rates of anxiety, depression, and trauma symptoms, as well as suicidality. Going back again, when people start feeling totally hopeless and helpless, when they feel blamed, when they feel invalidated, they may feel like they have nowhere else to turn, like they have no hope. And our job is to help them feel validated, help them understand these symptoms, what you're having is real, and it's not all in your head. It's not something you can just will away and suck it up. People with PCOS also have higher rates of bipolar, obsessive compulsive disorder, ADHD, and schizophrenia, which is interesting. It indicates that, and there's not a lot of studies that say which came first, the PCOS or the mental health issue. Knowing that a lot of these mental health issues cause stress, they may have contributed to the development of PCOS, but also knowing that PCOS alters not only hormones, but neurotransmitters, PCOS in itself may contribute to the development of a lot of these mental health issues. Estrogen, testosterone, progesterone, DHEA are all made more or less available based on the gonadal hormones that are present. Testosterone and estrogen play a big role in helping to manage and moderate the autonomic nervous system and make available the neurotransmitters we need to feel happy, to feel calm, to do what we need to do. Cognitively, people with PCOS often have brain fog. Well, they're not sleeping well, especially if they've got sleep apnea. But when our hormones get out of whack, our gonadal hormones get out of whack, when we're under chronic stress, when we've got inflammation and neuroinflammation, we're going to have brain fog. We're going to have neuroinflammation causes brain fog in and of itself. Poor sleep causes brain fog in and of itself. And people with, and stress also does. So people with PCOS have multiple things that are contributing to or causing brain fog. We need to help people figure out what can you do to live your most rich and meaningful life and have brain fog for the moment. I mean, hopefully we can help you get to the point where you can clear that fog. But in the early stages, what can we do to help you minimize the stress, minimize the cognitive overload of having brain fog? Distractibility and negative self-talk are also common. One of our neurotransmitters, norepinephrine, is involved in helping us focus, and dopamine is involved in our motivation. And dopamine and norepinephrine both get out of balance in people with PCOS. That negative self-talk, when you're not getting adequate quality sleep, you are much more likely to have difficulty controlling your thoughts, and you are much more prone to have ruminations. In addition to the fact that negative self-talk are often messages that we've internalized from others about our goodness and our abilities. Cortisol is your main stress hormone. It peaks in the morning and gradually declines during the day. This is called the awakening response. This is normal. You want some cortisol, or you're going to have no energy. Cortisol helps regulate circadian rhythms, blood sugar, metabolism, reduce inflammation, help with memory formulation, control salt and fluid balance, and help control your blood pressure. People who are chronically stressed, their cortisol receptors become tolerant, become not activated, if you will, by cortisol when it's released, which makes it more difficult for the body to control salt and fluid balance and blood pressure and regulate all these other things. So we're going backwards. We're looking at the person with PCOS and we're saying, all these symptoms they have could be in part caused by glucocorticoid resistance or cortisol resistance. One of the ways that we fix that is to help them reduce stress and heal their autonomic nervous system. We'll get there though. Adrenaline is a stimulant hormone that we have that triggers the fight or flight reaction and increases blood pressure, respiration, and blood sugar. Somebody who's chronically stressed typically has high blood pressure, faster respiration, and chronically high blood sugar or high A1C levels because their body's regularly dumping high levels of blood sugar to try to give us energy to fight or flee. Thyroxine is your thyroid hormone that helps regulate metabolism. Now remember, we're talking about all of those axes. And cortisol, if your body's becoming resistant to it, that means it's also becoming resistant to your gonadal hormones and your thyroxine and your adrenaline because they're all getting secreted in about the same amount. So thyroxine helps regulate metabolism, increases during normal activation of the HPA axis. It is inversely related to cortisol under conditions of chronic or extreme acute stress. So if you're under chronic stress, as cortisol goes up, thyroxine will go down. So we're not even, that thyroid's not even getting engaged. Now, as cortisol goes up, remember, if your cortisol receptors are resistant, it ain't going to do much until the cortisol gets way up here and finally the receptors kick on. Melatonin. We don't usually talk about this one, but it's important. Melatonin is created from serotonin, and it's anti-inflammatory and antioxidant. It assists with sleep promotion and is inversely related to cortisol. So if the person's cortisol spikes in the morning, but then never goes down because they're chronically stressed for some reason, then their body's not going to get the signal to start releasing melatonin. Even when they do go to sleep, they're probably not going to get good quality sleep. Estrogen and progesterone. Chronic stress, chronic cortisol release, reduces estrogen and progesterone, resulting in amenorrhea in women and possibly postpartum depression and autoimmune issues. Testosterone increases in response to cortisol and HPA axis activation. So we have estrogen, which is neuroprotective, is going down and under chronic stress, and we have testosterone going up, which is that recipe that we were talking about earlier that starts setting the female body up to have reproductive issues. Testosterone decreases under conditions of hypocortisolism or glucocorticoid resistance. So once the person gets to the point that they're just chronically stressed all the time, testosterone doesn't go up as much, but you still have estrogen that's down here in the basement. Oxytocin, our bonding or survival hormone, is positively correlated with cortisol, suggesting a social support-seeking response. When we get stressed, we want comfort. We want somebody to help us feel safe, or we want to protect those we love. So oxytocin can go up. Oxytocin is a powerful anti-inflammatory and can help regulate the autonomic nervous system. But like everything else, if those receptors are getting bombarded too much, they will start becoming resistant even to oxytocin. Dopamine increases in response to stress and excitement. It's our motivation chemical. I want to do that again chemical. The goal is to improve attention, vigilance, and increase survival-oriented learning and behaviors. Acetylcholine is positively correlated with stress, or the HPA axis activation, as well as depression. As acetylcholine goes up, serotonin goes down. So if it's positively correlated with if acetylcholine goes up, serotonin goes down. So as acetylcholine goes up, people's mood tends to go down. Norepinephrine is another neurotransmitter which is needed to synthesize and release melatonin by the pineal gland. When cortisol levels are high, this process does not take place. So it's not just serotonin. We need norepinephrine in order to make melatonin. And finally, glutamate and GABA, the twins. HPA axis activation increases glutamate, our main excitatory neurotransmitter. It gives us our energy, and reduces GABA, because now's not the time to relax. Repeated exposure to excess glutamate leads to tolerance. Since glutamate is broken down to create GABA, if the person's glutamatergic system is not working, then GABA will often be insufficient. If they're burning up all their glutamate on stress and they don't have any left over to break down to make GABA, there are other ways the system can break down. But ultimately, we recognize that chronic stress can cause low GABA levels for a variety of reasons. And serotonin. Serotonin balance is altered in response to stress, where one type of serotonin, 5-HT1A, goes down, and 5-HT2A goes up. Serotonin is broken down into melatonin when it's time for bed, but high levels of cortisol will prevent the release of melatonin, disrupting those circadian rhythms. Why are we going over all this? Because I think it's important for you to understand what's going on under the hood. Why chronic stress how chronic stress can alter those gonadal hormones and neurotransmitters, which can produce the symptoms that we're seeing. In PCOS, I told you we'd get here. Chronic stress causes the autonomic nervous system, our stress response, to become dysregulated. This leads to increased cortisol production, impaired negative feedback, or the system becomes unable to turn itself off, basically, and altered circadian rhythms. Remember, our ANS has the parasympathetic nervous system and the sympathetic nervous system. The sympathetic nervous system is your stress response. It has sympathy for when you're under stress, and it says, all right, I'm with you. The sympathetic nervous system becomes too strong under chronic stress because it's just constantly working and constantly getting stronger. And the parasympathetic nervous system, your relaxation response, is sitting over here just kind of withering away because it's not getting used at all. And one of the things we need to do in therapy is help people learn how to strengthen that parasympathetic nervous system. Hypothalamic pituitary gonadal axis disruption also can lead to elevated cortisol, or elevated cortisol leads, wow, I'm having difficulty today. Sorry, y'all. Elevated cortisol impairs luteinizing hormone and FSH secretion from the pituitary gland. Because stress causes elevated cortisol, then elevated cortisol impairs the body's ability to promote ovulation. This cortisol also directly impacts the ovaries. Alterations in the HPA and HPG axes cause polycystic ovarian syndrome through the process of basically disruption and dysregulation. When the HPA axis is dysregulated, it can lead to increased testosterone production. Remember, under stress, estrogen goes down, testosterone goes up. That's not what we want. This disrupts gonadotropin secretion and interferes with ovulation. It's a vicious cycle. Polycystic ovarian syndrome makes your stress response worse. It makes the HPA axis become more imbalanced. It increases stress related to symptoms that perpetuate HPA axis activation. So stress related to self-esteem, related to interpersonal problems, related to pain, sleep disruption, all those things we talked about. Those are stressful. Well, that stress increases the activation of the HPA axis. The HPA axis continues to pump out those stress hormones, which makes PCOS worse. The inflammation as a result of this chronic HPA axis activation stimulates further cortisol production, and insulin resistance impacts cortisol metabolism. As the person becomes unable to effectively use the blood sugar that is released into the system, we also have difficulty metabolizing the cortisol. Interventions, the part you've all been waiting for. Physically, one of the things we need to do is help restore balance to the sympathetic and parasympathetic nervous system. Another thing we need to do is help the person reduce inflammation. We are not nutritionists, we are not registered dietitians, but we can educate them about anti-inflammatory diets and the importance of them. We can make referrals to dietitians if they want one. Anti-inflammatory diets are typically colorful. They're rich in fruits and vegetables, those dark, rich colors. All of those have antioxidant and anti-inflammatory properties. They're high in omega-3s, including olive oil, and they typically are lower in highly processed foods like white sugars and highly refined flours. You try to focus on whole grains. Pre and probiotics are also really important in the diet because we want to restore the balance of the microbiome. Prebiotics are basically fibers like inulin, and you get fibers from those fruits and vegetables. You don't have to get something else out there. If you're eating fruits and vegetables, you're getting antioxidants and you're getting lots of prebiotics. It's wonderful. Probiotics are the bacteria you find in fermented foods like kefir and kombucha and yogurt. Those are things that can help really reset the system. Some people will, in the beginning, will choose to take a course, if you will, of multi-strain probiotics in supplement form. If they do that, it's best to choose something that has anywhere from 40 to 80 or more different types of microbes in the probiotic formulation, because that really helps make sure that you're adding the good bacteria. You don't know which good bacteria you're missing, and it's not just the yogurt bacteria, basically. Not everybody wants to do that, but a lot of people do that and find it does help with some of their symptoms. We want to talk with people about their sleep hygiene. What does your sleep routine look like? What keeps you from sleeping? Do you get to sleep quickly? If you're laying there for more than 15 minutes, probably a problem. If you go to sleep quickly, but you wake up every hour and you can't get back to sleep, that's a problem. So we want to look at how quickly they fall asleep, how many times they get up during the night, how quickly they fall back to sleep, and whether they're sleeping for at least a total of 7 to 9 hours. If any of those seem to be problematic, then we may want to refer them to their physician or to a sleep specialist for a sleep study. If they report that they snore a lot, especially if they report that, their spouse has moved to another room because they couldn't sleep due to their snoring, good chance they have apnea. If they report that they regularly wake themselves up snoring or choking or snorting, I've heard it described different ways. Again, they may have apnea. Some people will do that occasionally, especially if they're sleeping on their back. But if it's something that's regularly happening, it's disrupting their sleep. When you have sleep apnea, you're literally stopping breathing for a period of time during the night. And then your brain finally kicks back in and it's like, oh, yeah, breathe. Okay, that's what I got to do. That's stressful on the body. When the body is deprived of oxygen, it's a stressor. So in the middle of the night, every time you do that, your body is activating that HPA axis and dumping cortisol. So we want to look at that. We want to look at, are they doing a bunch of stuff in bed that is making their bedroom not a relaxing place? It's not the place to be answering work emails or paying bills or fighting with your spouse. We need to make the bedroom a warm, relaxing, or a comforting, relaxing place. We want to have it be cool because people typically sleep better between the temperatures of 68 and 72, so they say. I'm more like 62. So it's individual differences, but find a temperature that works well for you. I have a lot of other videos on sleep hygiene that you can look at if you want to get into the nitty-gritty, but many people have very poor sleep hygiene habits. Oh, and before I forget, blue lights. Install the blue light blockers on all of your digital devices and have them turn on automatically 2 to 3 hours before you go to bed. And that will help trigger the pineal gland that, hey, it's starting to get dark outside. It's time to start going to sleep. Circadian rhythm regulation is more than just sleep. Circadian rhythms are set by temperature, by light levels, and by activities, which is why having a routine is so important. When we are left to our own devices, most of us will naturally fall into a routine where, for me, because I get up so early, about 10:30 every morning, I start getting really hungry because it's lunchtime for me. And that's my circadian rhythm secreting hunger hormones that's telling me to eat. That's part of the circadian rhythm. So we want people to keep a relatively stable schedule and do things around bedtime, 2 or 3 things that will cue their body in that, hey, it's time to go to sleep. Coming home from work, changing out of your work clothes, eating dinner, taking a shower, whatever it is that you do that's your wind down routine or your get ready for bed routine is really important. So temperature, activity, and light levels. A1C regulation is also super important. Now, this kind of goes along with the anti-inflammatory diet, but A1C regulation means also making sure that you're not developing insulin resistance. Intermittent fasting has been shown to be very, very helpful for that. Not everybody can handle intermittent fasting, and we certainly don't want to add extra stress to people. It's important that the person, when they get evaluated for PCOS by their doctor, the doc will probably also look at their A1C levels and their blood sugar levels. we want to support them in making the changes that they need and help them figure out how to make the changes that they need in order to conform to their treatment plan for managing their blood sugar levels. Forest bathing, we talked about this last week, but it comes up again this week. Forest bathing means going out and being in nature. The closer it can be to actual nature, the better. So if you can't leave your house for some reason, all right, not the best thing in the world, but trying to do it can be very helpful. The terpenes, the smells that are emitted from the plants and the trees actually have system regulating effects on them. They're anti-inflammatory, anti-tumor, anti-proliferative, all kinds of antis that we want. So smelling nature can be very helpful. Being out in nature, there's a hypothesis that we are actually designed to gravitate towards natural spaces. So when we get into a natural space, it naturally helps us activate our parasympathetic nervous system, or our relaxation part of our autonomic nervous system. Earthing is another thing I don't have on here, but it kind of goes along with forest bathing. We talked about that again last week, but earthing means getting literally in contact with the earth, walking barefoot on the grass, going out and touching grass. You don't have to walk barefoot if you don't want to, but having your skin, or being on socked feet, whatever, just not having a rubber sole on between you and the ground, so you can discharge some of those negative electrons that are created from oxidative stress, basically. You can do it inside. They have mats that you can get that you can plug into a grounded outlet, so you don't necessarily have to go outside for earthing. But they've shown with both earthing and forest bathing increases or improvements in the parameters of blood pressure, hormone regulation, neurotransmitter balance, blood sugar, pulse, and heart rate variability. So forest bathing and earthing, getting back out to nature and literally touching grass, actually can help with PCOS. It's not going to do everything by any means, but it does help. Hormone therapies, both gonadal and thyroid, can be prescribed by doctors to help balance what's going on. PNS, parasympathetic nervous system strengthening activities via the vagus nerve, can be helpful. Encourage people to get practice grounding, for example. This is not earthing, totally different. Grounding is focusing on the present moment, identifying 5 things that you see, 4 things you hear, 3 things you smell, 2 things you feel. Or if you want to go simple, looking around your environment and identifying all of the things that are green or brown or red or whatever. But forcing your attention to be focused in the present moment for a period of time. A minute, 2 minutes, 3 minutes, it doesn't have to be a long thing. When we do that, we're forcing our body to turn our attention to that and stop focusing on anything that's stressing us out. We're not focusing about the pain in our back. We're not focusing on the stress from work. We're not focusing on the bills or whatever else. We're focusing on finding things in the environment that are brown. And that actually gives our nervous system a break. Breathing, it's always a good thing. Square breathing can be very helpful when people get distressed. One of the activities they can do to downregulate, to activate their parasympathetic nervous system and deactivate that stress response or that sympathetic nervous system is square breathing. Breathe in for 4, hold for 4, exhale for 4, hold for 4, and repeat. They don't need to focus on their bodily sensations because that can be triggering for some people. But that square breathing, 4 in, hold 4, 4 out, hold 4, helps slow our breathing, which naturally helps slow our heart rate, which naturally helps turn down the stress response. If you don't like doing the square breathing, try singing really loudly. Project from the diaphragm. Blow bubbles, whether it's bubble gum or bubble stuff. That can help. But you're going to slow your breathing before you try to blow that bubble, or you're not going to be successful. Meditation is also another activity that people can practice in order to strengthen their relaxation response. When you willfully engage in meditation, you are telling your body, you're telling your brain, hey, right now, we are going to focus on this. We're not going to think about that stuff over there or that stuff over there. We're going to focus on this, and this is calm, and this is safe, and this is empowering. So the amygdala gets the message and it says, okay, I'll take a break for a little bit. And the person is able to disengage, if you will, that stress response. We're actively telling the body, it's like you're going inside yourself and you're saying, okay, stress response, you need to take a break. I'm going to go over here right now and focus on relaxation. Pain management, helping people using guided imagery, meditation, breathing to manage their pain can be super helpful. Obviously, they may be on medications as well, but medications or not, there are a lot of cognitive strategies we can use to help people better manage their pain. We can help them learn distress-tolerant thoughts when they're having this pain in their back or their chest or wherever they're having it. Encouraging them to use distress-tolerant language. This sucks right now, and I know it will pass. Or I can have, some back pain, and I can still do this thing that's important to me. Helping them use words and language where they feel empowered to live with the pain if they can't get rid of it. That's one of the keys. You may not be able to completely get rid of it. Okay, is what it is. How can I live with it and move toward my rich and meaningful life? And hair removal. If somebody is having difficulty with excessive facial hair, they may choose to look at things like laser hair removal. That's a personal choice, whether they feel comfortable having lasers bombarding their skin, but they certainly can talk to a dermatologist about it, especially if hormone therapies aren't working to completely correct the problem. Interpersonally, we want to help people look at their body image, how they feel about the way they look, and how much of their self-esteem is invested in the way they look versus who they are. Are you a good person? Are you loving? Are you compassionate? Are you worthy of love, regardless of how you look? And that's one of the things that our society does not do well with. But we do need to help people recognize that their body, everybody's made in different shapes and sizes. Their body is their body. It doesn't mean that they are better or worse of a person. We want to help them address any grief, trauma, anxiety issues related to fertility. We want to help them figure out how to deal with chronic fatigue if they're feeling tired all the time. Now, hopefully this will start improving once they address the hypothyroid and the inadequate estrogen. But when they're experiencing chronic fatigue, how can they deal with that in a compassionate way instead of getting angry with themselves that they can't do everything that they want to do because they're just too freaking tired? And help them work on trauma. This is here because a lot of the traumas that people experience are due to interpersonal actions. Somebody did something to them or somebody abandoned them. And developing a sense of safety and empowerment in relationships is really important. Developing a sense of self-esteem and safety inside your own head, so you're not being your own worst critic, but also developing a sense of safety and empowerment with other people so you can feel connected, you can feel supported, is really helpful. People who have untreated or uncontrolled trauma will continue to feel unsafe and powerless. When you feel unsafe and powerless, guess what? That's going to trigger your stress response. We also want to help them educate partners about the condition itself, the symptoms, the triggers for their extra stress or things that may make their PCOS worse, and what I call sex alternatives. If they're having difficulty having regular sexual relations because of pain or frequent bleeding, or whatever the case is, are there other alternatives to meet the bonding and touch needs besides vaginal sex? There's a lot of things out there. Emotional and cognitive interventions, real basic stuff, help people define their rich and meaningful life. What's important to you? And then look at that rich and meaningful life and say, okay, how can you move toward these goals and have PCOS and have this particular symptom? Yes, you'd like to get rid of it, but let's just say for right now, you can't. What can you do right now while you've still got this symptom to use your energy to move toward the things that are important instead of using your energy to be angry at yourself or angry at the world because you have this symptom going on? Help them improve their distress tolerance and down-regulation skills. Breathing, as we talked about earlier, distress-tolerant thoughts can be really helpful. Turning their attention, distraction, turning their attention to something else for a moment. Urge surfing can be really helpful. If they have this urge, when they get stressed, they have this urge to scream. Okay, well, maybe they can find a safe place to scream into a pillow. All right, if that works for them. But a lot of these urges pass within 10 to 15 minutes, especially if they're not sitting there thinking about that particular urge. Helping them develop activities they can do. When you have this urge, what can you do? Or when you have this overwhelming feeling of distress, like you feel like you're fixing to spiral out of control, what can you do for the next 15 minutes? Encourage them to journal or talk with somebody for 20 minutes a day about what went right that day, what they had control over, what they succeeded at. The other 23 hours and 40 minutes, focus on whatever you want. But they have found that people who intentionally focus on the positive for 20 minutes a day actually have much more cognitive flexibility and tend to have improved scores on anxiety, depression, and pain measures. And of course, we want to help them address cognitive distortions. I will always feel this way, or I will never get any better. Everybody notices my facial hair. Those extreme words, all or nothing thinking, personalization. This person broke up with me because I was overweight. Well, maybe they did, but what facts do you have to support that? Maybe they broke up with you because they just found somebody else that they liked better. It didn't have anything to do with your PCOS. PCOS is a hormonal and metabolic condition that is caused by and causes stress in each piece of life. Many patients with PCOS have concurrent mental health symptoms, both cognitively and physically based. As many as 1 in 20 people in the general population have PCOS. When you start looking at the population that is presenting in mental health clinics, it's a whole lot higher than that. So the chances that you have worked with somebody in therapy who has PCOS is pretty daggone high. They may not have realized it because remember, 70% of those cases are either undiagnosed or misdiagnosed. We can help people advocate for themselves. We can help people find one of the root causes of their ongoing distress, which is so empowering when they are able to finally see, oh, that's why doing all these self-help books and everything didn't ever totally work, because my system under the hood is actually out of balance. My hormones, my neurotransmitters, etc. If patients have signs of PCOS, educate them about it. Refer them for a complete physical, particularly letting the doctor know that they're wanting to be screened for PCOS. And help them identify strategies to reduce unnecessary stress in their life and enhance stress management. So we can help them try to turn down that stress response, try to reduce the amount of time that sympathetic nervous system is just wide open, and help them increase the amount of time that parasympathetic nervous system is wide open, and the body's secreting serotonin and GABA and endorphins and all those feel-good relaxation chemicals. Are there any questions?